Hi, Mike Gibson, Javed Butler here. We're talking about BMI. Is that really the way we should be identifying patients? And should that be the target of our obesity trials? Javed, what are your thoughts?
So right now we have an inclusion criteria of BMI, and then what? Nothing, right? We don't have a stopping criteria. Is it lifelong treatment? What are we targeting? And if you're targeting adiposity, if adiposity is the disease, BMI and adiposity correlates, relatively very poorly.
Right.
There is a ton of people with BMI less than 30, less than 27, even in Asian population less than 25 that have a lot of adiposity, for instance. So one axis is, should we be targeting adiposity? The second axis is, should we be targeting body composition, right? So the balance between fat versus a skeletal muscle, and how does that balance, and frailty and all those kind of stuff. And then the third is the fat compartment. So not only, we have been all thinking about visceral versus subcutaneous adiposity, but there are some really interesting data also coming out that within visceral adiposity, there may be differences as well. So for instance, high fat content in the liver is associated with diabetes and metabolic syndrome. Okay, we all expected that. But surprisingly, overall high fat but lower liver fat content is associated with cardiovascular risk, right? So there's a lot that we need to understand. So hopefully we will get a little bit more sophisticated in terms of body composition and start targeting that rather than just BMI as an inclusion criteria.
Yeah, I agree, Javed. And some of their recent guidance documents, the FDA also highlighted the fact that BMI might not be the right indicator or the right target. So we have a lot more thinking to do in this topic. But Javed, thanks for joining us today. Thanks for all your insights. And thanks to all of you for joining us here for This Week in Obesity.
Thanks, Mike.